I'm Dr. David Rapaport. I'm the founder and medical director of Cool Spa, and what I'd like to talk to you about now is how not all lipos are created equal, and how we do lipo at Cool Spa. Lipo is a procedure I've been doing for about 25 years. Lipo is, of course, short for liposuction, removing fat to improve one's fatty contours. It's really probably my favorite procedure surgically, and I'll try to convey to you what I find new and exciting about it and how I do things. It's really important to understand that not all lipo is created equal. Lipo is sculpting, and just like, sculptors are not all the same. Liposuction by one person is not the same as another person. And there are elements in terms of the details of how it's done that are important to understand. Probably from the get-go, the one big difference of how I do things is that unless we're combining the procedure with something like breast augmentation or a tummy tuck, pretty much all of my liposuctions are done under IV sedation, or some of the time under local anesthesia with or without oral sedation. So what that means is we don't do this procedure under general anesthesia typically. You are breathing on your own, you are responding to commands. When I ask you to bend your knees and lift your butt and roll on your side, you're doing it, probably or possibly with a little help from me, but you're doing it. I think that's really important because in terms of safety, it isn't good to give up vital functions that don't need to be given up. Meaning if you can breathe on your own, you breathe on your own. You can move on your own, you move on your own. You don't need ventilators and tubes going down your throat. Now, it's true that it takes particular skill on the part of the anesthesiologist to deliver safe sedation. And I've been working with the same anesthesiologist for over 10 years, Dr. John Grillo, who does a tremendous job. And when we don't have Dr. Grillo, we have very hand-picked anesthesiologists who excel at the sedation technique, because it really takes more skill to give good sedation than it does to give general anesthesia in many ways. There are also technologies that we've been using in the last few years that I think really help improve the results. In essence, the key to good lipo is experienced hands doing a good job sculpting, and the key technology's been around since the early 90s, and that's what we call the Tumescent Technique. That means that the tissues are being injected with fluid. The fluid has lidocaine, which is a numbing medicine, as well as very dilute epinephrine, which constricts blood vessels. Without the epinephrine constricting blood vessels, lipo wouldn't be what it is today, because there'd be a lot of bleeding and a lot of inaccuracy. Also, fine tools are generally better than big tools, because we're sculpting trying to get just the right contour, and fine tools are better for that. There's a technology called Body Tite that I've been using for probably about 7 years now. Body Tite is a very helpful technology in selected cases. This is an example of a Body Tite handpiece. This is a fine, small part that goes in through the little incision, and this thing is what goes on top of the skin. So if this is the fat that's going to be sculpted, this goes under the fat, this goes over the fat. So let's make believe this is the abdominal fat, it's full. Let's say the person's 40 years old, maybe they've had a couple of kids. Think about it, when you take that fat out, now things are going to tend to sag on that person who's a little bit older. Things have been stretched out, it's not necessarily going to bounce right back. So what this Body Tite does is reduces that tendency to sagginess. And the way it's doing it is using something called bipolar radiofrequency energy that's going from one point to the other. So if this is the abdominal flap that's going to be thinned out, before we thin it out, after we numbed it up, we put this in, and this is sort of beeping slowly, putting that energy in to shorten these fibers. Those are the fibers that would make the belly sag, or the inner thigh, or the arm. Those are the huge areas where we use this a lot, but it could be the male chest as well. So we want to shorten those fibers that are coming in this direction, because now the tissue is going to be empty. We don't want it to sag, we want the fibers shortened, and that's what this Body Tite does using bipolar radiofrequency energy, heats the tissues, shortens the fibers, and that's really important. Now, in general, if you're going to have lipo without the Body Tite, my patients, I only require a garment typically for 48 hours. But if you're going to use this energy to tighten those tissues, then I'm going to want you typically to wear support, specifically during the daytime when gravity's pulling everything down. We're going to want you to do that for 6 weeks. Now there's another technology made by the same company, InMode, that makes Body Tite, and that's called Morpheus. And Morpheus is used when we anticipate not the sagging of the whole tissues, but the crepiness of the skin itself, laxity in the skin itself. And so we're going to use Morpheus sometimes alone, sometimes with Body Tite as a supplement to liposuction. That involves little needles out of this thing. I don't know if you can see it, but there are 24 little needles coming out. The needles are sheathed, meaning they are coated, and only the tips emit also bipolar radiofrequency. The beauty of this technology is that we can decide how deep those needles go every time I push the foot pedal, so that we can both do some additional fat reduction if we want to, or when it's with liposuction where I'm doing gold standard fat reduction, it's to help tighten the skin, so we can put those needles superficially into the skin to help tighten them. And again, it's a topic for another conversation, but this is an amazing technology in terms of achieving tightening of the lower face and neck particularly, without anything else in some cases. We're seeing some tremendous results with Morpheus. There's another technology in liposuction which we use selectively based on patient desire and request, and that's called high definition liposuction. That is for the person that wants to have definition of their muscles, the inscription, the midline, to really have a more athletic and cut look. I generally don't like carving muscles out of fat because I think that looks kind of weird, especially when you gain weight. But I think assisting somebody getting the definition of the actual shape of their abdominal muscles, both on the sides and the midline and on the inscriptions, whether they're going to have a 4-pack or a 6-pack, is something we can do on selected patients who desire that. There's a concept called equalization, which is new, relatively new in liposuction, and that is something along the theme of fat transplantation. Equalization means that during the procedure or near the end of the procedure, I'm moving a cannula around but not doing liposuction. I'm basically helping distribute the loose fat cells and even things out, and that is a very good concept that's been introduced in the last couple of years to liposuction, which I think helps us get nicer results. Finally, fat grafting, as I alluded to, is something we're doing a lot more with liposuction. We've done quite a few women recently who wanted to have body contouring, want their bulges to be improved, want their breasts to be enlarged, but don't want breast implants. So fat transfer to the breast is now a viable option. There's a lot you need to hear about it and understand about it. It isn't the same thing as a breast implant, but it is a valid technology for creating breast enhancement without a breast implant, and it's something that would need to be discussed one-on-one to see if you're a good candidate for that. Finally, we can offer our patients something called stem cell banking, which is also pretty cool. The basic idea of that is that about 10 years ago it was discovered that we have stem cells not just in our bone marrow but also in our fat. What are stem cells? Stem cells are cells that have the ability, under the right stimulation, to grow into any kind of cell. Nerve, bone, muscle, anything. So they're really fascinating cells that scientists are studying a lot. And for example, right now we know we can treat leukemia with stem cells. There are many diseases that we will probably be able to treat because there are many advanced studies going on. And Now, thanks to a company called Forever Labs, I am able to take some of the fat that's harvested during your liposuction, and instead of throwing it away, or again, there's the option of grafting, but we don't need a lot of that fat, only about 50, 60 cc's. That's a fifth of a cup. And we send it to Forever Labs. They extract your stem cells, they culture them, they confirm that you have good, healthy, viable stem cells, and now your stem cells can then be banked perpetually. Aside from the possibility of curing diseases that we don't even know we can cure yet with stem cells, I foresee that in the not distant future, we're going to be able to probably perform rejuvenation procedures also using stem cells, and that's really exciting. We know now that if you take genetically identical mice and you take the stem cells from young mice and inject them into old mice, the mice live longer, and they seem to be a little happier mice too. So it's probably not going to be a long time from now that you'll be able to use the stem cells that you harvested when you were younger for rejuvenation procedures when you're older. It's sort of like a backward type of time travel, so that if you have the procedure when you're 30, when you're 50, 20 years later, there's still a bit of you that's still 30 that can be grown into all kinds of things. So that's a very exciting thing that many patients are taking advantage of. I hope this little talk has been helpful in demonstrating some of the new things and different things that we do at Cool Spa when we do liposuction, and I look forward to hearing from you and seeing you in person if that's what you choose to do. Take care.